What is a stroke? A stroke is when part of the brain loses blood supply because of a clot or a torn artery that leaks blood. It is very important to know the signs and symptoms of a stroke. Use the acronym BFAST to help you remember them. B is for balance, E is for eyes, F is for face, A is for arm, S is for speech, and T is for time. It's also important to recognize and manage your risk for having a stroke, which includes having high blood pressure or diabetes and smoking. Did you know that you can help prevent a stroke? The biggest factor is controlling blood pressure. You can help this by keeping track of your blood pressure and taking your medications as prescribed. Other things to help prevent a stroke include eating a balanced and healthy diet and being physically active. But before you start an exercise plan, check with your healthcare provider first. Depression can be common after a stroke. In fact, about 1 in 3 stroke survivors develop symptoms of depression, usually within the first 3 months after a stroke. However, some stroke survivors may also feel symptoms years later. Symptoms of depression may include feelings of sadness or hopelessness, lack of interest or pleasure in usual activities, feelings of guilt or worthlessness, changes in sleep pattern, and changes in appetite. Anxiety after a stroke can also be common. Anxiety can happen within 2 weeks after a stroke and is usually due to fear of another stroke or worry over the recovery process. Symptoms of anxiety include feeling irritable, difficulties focusing on things, not being able to control your thoughts about things that worry you, feelings of being in danger or fear of danger, and not being able to stay still. Symptoms of anxiety or depression, along with several other factors including fear, changes in personality, irritability, and stress, can all have a negative effect on your recovery. This is why it's very important to recognize depression or anxiety and get help. And there are several treatment options, including medication, counseling or talk therapy, and stroke survivor and family support groups. If you have any questions about the topics discussed here, please reach out and talk to your healthcare provider team. You can also find important information about stroke recovery on the following website for the American Stroke Association and information about support groups through the Stroke Warriors and Memorial Hermann Hospital. If you or someone you know is struggling with suicidal thoughts, call or send a text to 988 to get immediate assistance. Thank you for watching.